So capsular contracture, although rare, is a legitimate thing that we try to avoid or decrease the risk as much as possible. It used to be more common above the muscle with specific implants. Then they came up with textured implants, which the thought was would kind of break up the capsule, and it did work. And then over time, people started putting them underneath the muscle. The thought was that the muscle is constantly moving the implant. There's no direct connection with the implant and the breast tissue, which could create some issues. So there are some of the benefits. So typically I like to do below the muscle because that helps with that. Also helps the muscle draping over it look more natural, and it kind of holds things up. The other thought is that if you have some contamination that causes some inflammation but not an infection, that could lead to a little bit of firmness on the capsule, or if you had a bleed, that inflammation could lead to capsular contracture. So I'm pretty anal about when I'm doing my dissection, making sure everything's completely dry, and then washing everything out with 3 different kinds of antibiotics and betadine. And the goal with the antibiotics is it's clear fluid in, you want clear fluid out. And then the next step, coating the implant with either betadine or antibiotic solution prior to opening. So if there's any dust in there, it's not pulling down and sticking on the implant. And then not even touching the implant and putting it in a funnel, changing your gloves. And then putting the implant into the pocket and then immediately sealing it off. So there's not a lot of exposure and not a lot of touching, which really decreases the risk of capsular contracture. There's certain implants that some of the studies say have a little less risk, but I think they're all great. But I really think it has to do with technique and location of the implant. And there are some things not in our control, but we're very careful about the things we can control to keep the risk extremely low.